Thank you, John. Let's hope I can work the clicker and don't... Well, as John has said and Martina has said, this is the third symposium. The first symposium in 2016 was really to launch the Health and Social Care Board Commission study of family-focused practice. And that was a very large-scale study, and in 2018 we came together again and we talked about the findings of that study and also finished at the end of that with some recommendations. So today really, for a large part of it, is about how have we met those recommendations to convey back to you in services the good work that you're doing and give you acknowledgement of that and give you examples. And as John said then, towards the end, to learn from our international colleagues and have a discussion then about next steps going forward. So that was the initial study. And today, basically, I've got 10 minutes. We'll have an extended coffee break. We're ahead of schedule. I'm not going to interrupt that. So we'll talk quickly about the nature of the study, the key findings, the conclusions and recommendations. I'm going to try and link it in then to the presentations that are going to come after mine throughout the day. So this is just a reminder of what we've done. We distributed the survey to 3,585 professionals within adult mental health and children's services, and we got 868 professionals to respond, and then we had interviews with 30 professionals and 21 service users. And I do want to say that while parental mental illness can it's a global public health issue. There are impacts for children, but also for the parents, and we need to support the parents as much as we need to support the children. And that families that have effects from parental mental illness, in Northern Ireland there are many of us in that situation, and many of us are resilient, and that resilience can be further promoted then with optimal service response. And those of us who aren't as resilient, well then it's really, really essential that the services are tailored to meet our individual family needs. So when we looked at the extent of family-focused practice, we found that overall, despite the initiatives from 2009, by 2017 when we were collecting data, that the majority of health and social care professionals really weren't that family-focused. Those that were tended to be social workers, working in children's services. Other professionals who were family focused were those who were working within the home environment and were in the middle of the family context, more flexible in their role and more able to work and engage with the family. Social workers were most family focused, followed by nurses, then psychologists. Psychiatrists were least family focused. How many psychiatrists have we got here? But it's all about, it's not just about mindset and how you want to extend yourself, it's about the support you get from your organisation to be family focused, and therefore there's going to be a focus on that today as well. And we found that the single most associated factor for those who were family focused was their knowledge and skill. Knowledge and skill about the impact of parenting on children and the impact of children on parents and their mental health of the parent. We asked particular questions about the use of the family model because, as you know, the Health and Social Care Board, former Health and Social Care Board and now future SPPG, in the future we will be encouraging use of the family model, and there's been an A5 card developed and professionals were encouraged to reflect on that in their clinical settings and to use it to have this structured conversation. So by 2018 really we were trying to gauge how often this was being used, their understanding, and we found that 19% reported that they were aware of the model, with only 10%, which was 85 people in total out of 800 odd people, using the family model in their work. So, based on those findings and based on our qualitative interviews, especially with those with service users, we made a number of recommendations. And I'll quickly go through these because Martina has covered this and stole my thunder. And it was mainly around the need for a strategy going forward for this thing we call implementation science that Bjørg Ivar from Norway is going to elaborate fully on towards the end of the programme. So it was about a strategy to promote health and social care professionals' capacity to engage in family-focused practice, to allow them to feel supported, that within the limited time that they had, that they felt they were going to be able to engage in family-focused practice. So they needed guidelines, they needed it infused in their job description, they needed ongoing training, and these recommendations were around that. And so Martina has said what has happened. The Think Family Northern Ireland Consolidation Plan then generated from the recommendations, and that's a work in progress. And I just want to make a note that really some of our presenters today, maybe most, have lived experience of parents who have mental illness or being, a child in an adverse situation. And that just illustrates the importance of that plan being operationalised and us all engaging with this. So another recommendation that we made was that each health and social care trust should formally adopt the family model as a basis for future development, Think Family Northern Ireland. And there has been some good development in operationalising this model. In 2018, there was some findings from the Think Family Social Work Assessment Pilot, which was done in partnership with the Social Work Strategy. And it was implemented in a small-scale way across all 5 trusts, and Kerry McVeigh overseen all of that, and she has published her findings in Advances in Mental Health, and those findings are really, really important and interesting, because it indicates that the family model, which promotes a structured conversation, really does increase the quality of families' lives. And there were statements in that pilot study from families, professionals of all disciplines, and it's a good foundation to build on in terms of further endorsement of the model, and then encouraging professionals to use it, and subsequent research on that as well. And Barry Delargy, we're very happy to have here, because he's someone who is a Think Family practitioner, a social worker, and he's using this model in practice. And later this afternoon, he's going to talk about that and the benefits for him as a professional, but most importantly for the service user, the mother in this particular circumstance, and the children. Another recommendation, as Martina said, was this regular in-service training on family-focused practice and the family model. And we have done a lot with that too, and you're going to hear more about that. So to supplement the face-to-face training, we developed an e-learning resource in conjunction with Norway and with Dr. Adrian Falcoff in Australia. And Adrian is going to get up later and talk about that e-learning resource, how you can access it through the leadership system? I should know what the other thing. The Leadership Centre hosts that e-learning resource, and we have recently developed a manual for supervisors to help in supervision sessions, so that they understand what this e-learning resource is about in terms of the family model. And my colleague Bente Waymond in Norway and Adrian Falcoff developed that final part of the e-learning resource, and so Adrian will speak to that afterwards. Another recommendation then was around the champions, and following on from that, we still support the champions in their roles going forward, but the Think Family senior social worker practitioner positions have been created in 4 of the 5 trusts, and again those 4 professionals will get up and do a joint presentation and let you all know what their work entails, what they would like to do going forward. They'll be wearing a badge today, so if you have any further questions outside of the presentation, you can approach them, because they're a really good resource now and for the future to help embed family-focused practice. Okay, and one of our other recommendations was then about further evaluation and further research, because since 2009, I think Family Northern Ireland has developed so well, because there's been this good partnership between Queen's University and Ulster University, and we work in a reciprocal way to embed family-focused practice through us providing understanding of what's going on at grassroots, and then by services further shaping what's going on. So extra funding did become available and particularly after the last symposium, when we talked about the lack of understanding about prevalence of parental mental health in Northern Ireland, and the need to address that gap. Because if you do research and you find that there's a high prevalence, then that can encourage policymakers and funders then to fund more projects and more research. And so, following on from the symposium, there was an audit done, and that was led by Claire McCartan, very instrumental in that, and that kind of complemented in a way, unfortunately, the 2-year study findings. The results were the same. You know, there was patchy progress in terms of family-focused practice, but it certainly wasn't the main thing. Most people weren't able to practice in a family-focused way, or comprehensively enough. And then, following on from that, in the most recent study was the mental health of children and parents in Northern Ireland. And as we said before, that study was led by Professor Lisa Bunting in Queen's, with many of our colleagues here part of that. And Claire and myself will be talking about that in a presentation just before lunchtime, the results of that. And that's my presentation. Thank you for listening.